Welcome to my presentation on how probiotics have an effect on irritable bowel syndrome. What is irritable bowel syndrome, or otherwise known as IBS? It can be characterized by irregular but frequent abdominal pain, altered bowel habits such as diarrhea or constipation, bloating, and flatulence, and it affects about 5 to 11% of the world's population. The issue is that current therapies are just insufficient, inconsistent, and ineffective. And medical IBS treatments, unfortunately, do not cure the actual cause. They basically just manage the symptoms. Some of the medical treatments for symptom management can include antidiarrheal agents, antibiotics, laxatives, antispasmodics, or antidepressant. But they only manage symptoms and they're not long-term solutions, so there's really no consistent practice in place to cure IBS. The symptoms are varied, and they can be all or just some of the mentioned ones up here: gas, abdominal pain, diarrhea, constipation, which of course involves straining, incomplete evacuation, bloating, nausea, vomiting, reflux, and anxiety that's associated with having these symptoms on a regular basis. So there's not a complete understanding of what exactly causes IBS, which is part of the problem. One of the theory is dysbiosis in the gut flora, which means it's the wrong balance of good versus bad bacteria, to which probiotics are a promising treatment because they can restore the flora to the proper balance. The second theory is that after having some sort of microbial infection, an inflammatory response is triggered. Also, this includes the use of antibiotics, which alters and can damage the intestinal flora. Probiotics, they may have some antimicrobial and anti-inflammatory processes and can also contribute positively. So probiotics are defined as bacteria or yeasts that improve health, which can restore the right balance of bacteria or a normal flora in the gut. There's many types of probiotics, so it was found that probiotic blends with more than one strain more effectively can help reduce symptoms. This is because each strain has slightly different effects, and also the strains together may have a good synergistic effect. Barely any studies found that probiotics can help with decreasing IBS symptoms. Choosing the probiotic strains, there is a lot to choose from between genus and species and then the subcategories. So the research showed that IBS patients have a lower amount of a particular strain called Bifidobacterium and Lactobacillus already in their gut, which can contribute to problems. In various IBS trials, I observed most the probiotics are of those Lactobacillus and Bifidobacterium genuses. And particularly Bifido infantis was determined to stimulate some anti-inflammatory responses that had originally triggered the IBS. So to hone in on the probiotic strain of choice, I narrowed it down to 2. And many scientific trials used the following 10 species. The ones that are bolded, another piece of research found that they have the best effects on reducing bowel movement frequencies and pain. So then I looked up common brands that are currently sold in the stores, available over the counter, and those brands all included Lactobacillus paracasei and Bifidobacterium lactis, so those were the choices. So the purpose of this study is it particularly focuses on diarrhea-dominant IBS due to the fact that it's disruptive, unpredictable. It's one of the most emotionally troublesome IBS types to have. The population is women between the ages of 20 and 50, because women are 2 to 3 times higher likely to have IBS than men, and the majority of people affected by IBS are also young. A certain study found 20 to 39 is the age range. I made mine a little more. So all in all, the purpose of this experimental study is to determine whether a probiotic blend of both Lactobacillus and Bifidobacterium has significant effects on relieving IBS symptoms. So generally the goal is to hone in on a consistently used and recognized probiotic strain, which people who are diagnosed with diarrhea dominant IBS can rely if they're making an over-the-counter probiotic purchase, or doctors, when making a prescription of a higher dose or a more quality probiotic, also know which strain could have the best responses. So this leads us to the research question that for women with IBS-D, does the intake of a probiotic blend reduce the frequency and severity of IBS symptoms compared to the strains taken individually or just a placebo? The hypothesis to this question is that the probiotic strain blend will have a stronger effect on reducing the symptoms in women than the strains do individually, and definitely more so than the placebo. So moving on to the experimental procedure. This is an experiment that's going to be done in a university, a randomized, double-blind, placebo-controlled study. It's going to last 4 weeks. Lots of studies lasted that long, and what was interesting is that a study testing probiotics in IBS found no difference between 4 to 8 weeks, so we will keep it shorter. Statistical testing of the results will be independent samples t-test to determine the difference between all the independent sample groups that we are going to look at. To gather participants, various GI websites that people go to for answers and for guidance had a section that helped recruits the participants for the study. Basically, it advertises the study, and volunteers were invited to submit the email if they were interested in participating in a low-risk, non-invasive IBS treatment. Then the volunteers are contacted by the recruiter, then followed up with a phone call to proceed. Exclusion criteria study is if they are taking medications or medical treatments for IBS that they cannot stop for the trial. Also, diagnosis of more serious conditions such as ulcerative colitis and Crohn's are exclusion because we don't want, that's a different category. We don't want to stop treatments for that. So choosing the participants from the ones gathered, the number was found via G-Power, inputting a significance of 5%, 83% power as done by another study, 27% attrition rate, and effect size of 0.5, which is medium. After all said and done, a total of 68 subjects divided into 4 groups with 17 members were picked. The study is remote, so they did not have to be in any specific geographic location. The therapy went as follows. Probiotics were delivered in the mail to the participants' homes with instructions included. The participants received 1 out of 4 capsules. One of them was a blend of Bifidobacterium and Lactobacillus. One was only Bifidobacterium lactis. The other one was only Lactobacillus paracasei. And the other was a placebo. They were required to record their intake. The proper form to make it easier was provided, which helped them keep on track and was also important for the researchers' documentation. Data collection. Basically, compliance is a little difficult to ensure in a remote study, which is why it was shorter for 4 weeks to help increase compliance. Compliance was categorized at 80% intake of the capsules. Exclusion criteria post-intervention was people who did not properly take the probiotic or stop the regimen, possibly due to adverse effects or just lack of interest. The information that was collected, basically on a weekly basis, participants fill out an online survey rating their symptom frequency and severity on a 5-point Likert scale. The symptoms could be the usual gas, bloating, pain, discomfort with diarrhea, vomiting, nausea, and the score, it would strive for a lower score. So the questions were set up in a way that made a lower score more desirable. So never having the symptom or having the symptom improved. There was also another section in case there was something that they want to add that was not could not be categorized by the Likert. So after all was said and done, to analyze the results, the intended outcome is to have a significant and notable relief from the decrease of these IBS-D symptoms of the probiotic groups compared to placebo. The blend, of course, is expected to have the best results. The individual strains will also have an effect, though estimated to be less, and the placebo is not expected to have any results. The goal is to get one step closer in finding the ideal probiotic or probiotic blends for managing IBS-D. The limitations of this study is the potential of non-compliance because the subjects are doing everything at home, and also potential incorrect recording of records, or maybe fudging a little bit, making things up. Another limitation is that there was no biological specimens of stool samples to test the flora or any other kinds of tests. Also, some studies found that dosage makes a difference. There was one that tested the same probiotic at different dosages and found that certain dosages had the same effect as a placebo, but one dosage had a significant improvement. Another future addition to this experiment could be a cohort study of the dietary intake of the participants who had positive effects from the probiotic to see if there's something about the way they eat that makes the probiotic more effective. So thank you so much for listening, and have a great day.